Public perception often links breast cancer primarily to family genetics. However, clinical data reveals that roughly 90% of cases are not inherited, but are instead acquired through environmental factors. These triggers are often subtle aspects of daily life. Long-term chronic stress, severe sleep deprivation, and frequent exposure to unregulated estrogens found in certain beauty supplements actively disrupt the endocrine system, creating the biological conditions a tumor needs to take hold. The fear surrounding the disease is rooted in its medical heritage. In previous decades, such as the period when the host's mother was diagnosed, a late-stage discovery left doctors with few options. The surgical response was invasive, mechanical, and required a long, difficult recovery. Because the radical mastectomy was once the primary tool for survival, an entire generation of women carried visible physical and emotional scars. This collective legacy of disfigurement is what continues to drive the modern association between a cancer diagnosis and the immediate loss of a patient's identity. Moving past that fear requires a shift in how we monitor our health. Relying exclusively on feeling a large 2-centimeter lump is an outdated strategy. By the time a mass is that easy to detect by hand, the cancer has often advanced past stage 1. Many early warning signs are visual. Patients should look for sudden asymmetrical growth in one breast, persistent skin redness that doesn't clear up, or localized dimpling with a texture similar to an orange peel. When a lump is present, the texture provides a clue. A benign mass usually feels like a smooth, circular marble that rolls freely under the skin. In contrast, a dangerous malignant mass is typically irregular and jagged, remaining anchored tightly to the chest wall. Catching these anomalies early is no longer a path toward the invasive surgeries of the past. Instead, it is the entry point into a highly tailored scientific pipeline. Modern oncology has moved away from simply measuring the physical dimensions of a tumor. Today, the immediate priority after a biopsy is analyzing the cancer's microscopic DNA blueprint. Doctors conduct a cellular interrogation, checking if the tumor relies on specific hormone receptors to survive. These receptors act as docking ports on the cell surface, actively absorbing hormones like estrogen to fuel growth. For hormone-positive tumors, oncologists launch a targeted counterattack. They administer drugs to plug those exact receptors, cutting off the fuel supply and starving the cancer cell. This treatment is entirely bespoke. It identifies the cancer's specific biological appetite and turns that vulnerability against the tumor itself. The challenge deepens when a tumor possesses 0 targetable receptors on its surface. When tests for estrogen, progesterone, and the HER2 growth protein all come back empty, the diagnosis is classified as triple-negative breast cancer. This subtype is aggressive. Because it lacks identifiable docking ports to target, doctors historically had to rely on traditional chemotherapy, a treatment that circulates through the entire body and attacks healthy cells along with the cancer. For years, triple-negative tumors represented the limit of precision medicine, requiring a fallback to these systemic and difficult treatments. To bridge this gap, researchers developed the ADC, or Antibody-Drug Conjugate, a breakthrough designed to fight aggressive, targetless cancers. Unlike traditional chemo, this delivery system ignores healthy tissue entirely. It moves silently through the patient's circulatory system, searching for its specific destination. The ADC molecule is engineered for exclusive molecular recognition. It bypasses healthy tissue and triggers its chemotherapy payload only after it successfully binds to the markers on the cancer cell wall, releasing the toxins strictly inside the tumor. By containing the drug within the physical boundary of the tumor, the ADC transforms a general poison into a microscopic sniper strike. For the patient, this targeted approach means that devastating side effects like severe weakness and constant vomiting are significantly reduced, preserving their ability to maintain a daily routine. The reliability of these outcomes has led major healthcare systems to subsidize ADCs for severe cases, providing patients with access to the highest level of precision care. All these advancements depend on early detection. Proactive screening remains the essential first step, allowing doctors to map the tumor's profile before it spreads. Because of microscopic precision, a breast cancer diagnosis is no longer a definitive end. It is a manageable condition, allowing women to receive life-saving treatment and return to their lives.